I'm really excited about this lecture. I am Matt Wade. I am a cataract specialist here at UC Irvine, and I'm excited about this lecture because I get a chance to talk about the humanity um, behind surgery, right? It's not just, what laser do we use and what lens do we use, but there's also the emotions of going through surgery. And so this is kind of interesting. I don't know if we've had a talk exactly like this before, and I'm excited to talk about it. So, hopefully you have lots of questions and we can go over those. I have a few slides I want to go through, but let's save your questions and let's hit those at the end if you like. So I'll start by sharing a little experience. So I'm a surgeon, right? I do surgery every week, and I went on this amazing hike in Utah not too long ago, and I tore something in my hip, and I needed surgery. And you'd think as a surgeon, gosh, no problem, no fear, right? But I was actually kind of terrified, to be honest, to put, somebody else in control of what was going to happen with my body. And so I empathize with the stress, the concerns, the all the emotions that happen before surgery, particularly with the eyes. I mean, the eyes are so much more important than the hips. I'm a little biased, but that's what I think. So let's talk about it. So the eye looks a little something like this, and when the cataract develops, it looks a little something like this. So we have this cloudy aspect in the middle of our vision, and patients come in and they say, "Gosh, I know I've been told I have cataracts, and I know I need to do something, but I'm stressed out. What do I do?" So the goal, obviously, is to go from a situation where there's high stress to one where there's a lot lower stress. And I think there's a few things we can do. That everyone's going to have their own approach to this. Everyone has their own approach already to dealing with stress, but I think there's a few things that are particular to the cataract surgery process, and hopefully they're helpful to you. So, and here's the list. If you're short for time, you can just screenshot this and move on. But we're going to talk about taking our time, learning the basics, understanding the journey, and involving a friend. So, taking your time. Good news is cataract surgery, by and large, is not an emergency. So it's not something you have to jump into right away. There are a couple instances where that's not true, but by and large, you have time to think about this. Patients ask all the time, gosh, when do I need, is it ripe? Is it ready? Do I need to have this done? And typically I just put it back and say, how much are you bothered? And if they're not bothered, we can wait. Cataract surgery is not an emergency. So we have time to take our time. If you feel like you need another opinion, you feel like you're just not ready yet, you can take a breath. We can take our time. So in terms of learning the basics, surgeons speak surgeon and patients don't always speak surgeon. So I don't think you need to learn everything about cataract surgery. In fact, I think there is a online research hole that you can go into so deep that you're just going to confuse yourself. Not that I'm saying don't go there, but uh, just temper that a little bit with coming in and talking to us because we can provide a lot of context and help. But it is useful to learn a few of the basics, a few of the basic terms. And any of these things that we're going to talk about could be and actually are like full hour lectures. So we're just going high level. Come back to the other lectures that Dana talked about if you want a further deep dive into what these are. But I think it helps to come in knowing a few of these things. So first off, what is a cataract? Well, the cataract is the lens inside the eye that initially when you were born was clear and was flexible, allowed you to see far, allowed you to see up close, and over time has slowly become inflexible first, which is why in our 40s we need those beautiful reading glasses, and then eventually becomes more and more cloudy, and it starts to look like the picture on the right. And you can imagine it's hard for light to get through that lens. So here's an image. You have this leaf. The light is going through the eye and it's projecting onto the retina. The retina is like wallpaper on the backside or on the inside of the eye. And that image is coming through nice and clear when the lens is clear. But as the lens gets cloudy, you can see how that image on the retina is just so cloudy at that point because light coming in is hitting those cloudy spots, kind of like a marble, right? That has cloudy spots to it. And the light is just scattering every which way. So at that point, it's hard to see through that lens. That lens is no longer functioning for you. Oh, next, we're going to talk about what is dry eye and why are we talking about dry eye when we're talking about cataracts? Well, dry eye is literally the surface of the eye, and you can see all these dry spots on this cornea here. There's a special dye that's been placed that helps light these up. But imagine light coming in and hitting the surface. There's no way it's going to be focused properly when it has all these spots to deal with, because each time it hits one of these spots, the light, part of it scatters, just kind of like it did with the cataract. Here's another kind of cartoon version. A normal tear surface should be nice and smooth. That's the perfect thing that's gonna focus the light for us. But when it's not smooth, when we have these bumps and these spots, the light really doesn't focus well. So let's put it like this. Right here with the blue arrow, we have the cataract, which is causing blurry vision. Here in the red, we have these dry spots that are also causing blurry vision. So we have two problems right in a row. It's not uncommon for patients to come in and we say, gosh, we see dryness, we see cataracts. Why don't we stop for a few minutes and let's have you, or a few weeks actually, and let's have you treat the dryness first and then come back. And I've had patients come back and they say, Doc, I'm good. I don't need cataract surgery. I can actually see better now that we've treated the dryness. And I know I have a cataract, but I'll come back and treat that a little bit later. The other benefit is when we treat the dryness, the measurements that we need for cataract surgery are so much better, so much more reliable. So when you come to talk to us, you're going to hear us talk a lot about dry eye. In fact, every single time someone comes in for cataract surgery, we spend a lot of time talking about dry eye. And it's not just beforehand, it's not just for the measurements, it's not just for determining, is it time to go ahead with surgery? But we know that dryness gets worse with time. I like to say birthdays, not age. Dryness gets worse with birthdays, and it flares for a few months after cataract surgery. So anticipating that we're going to have a flare after the surgery, we better get on top of the dryness beforehand. And so cataracts and dry eye both cause blurred vision. My happiest patients are the ones who spend the time before, during, and after treating the treating the dry eye, because again, you can remove the cataract, but if you still have blurry vision from dry eye, you're not going to be as happy as you want to be. Okay, so what about astigmatism? Everyone's heard this word, or many people have. Astigmatism, you're typically introduced to this when you go to the optometrist, and they say, well, you have astigmatism. We need to put part of that prescription in your glasses. And a pair of glasses prescription corrects for three things. One is the distance or near. The second is the astigmatism, and I'll tell you a little bit more about that on the next slide. And the last is, as you get into your 40s, that reading addition or bifocal or progressive that helps you go from far away to up close. So let's talk about what is astigmatism. Well, astigmatism just means that the front surface of the eye, instead of being perfectly round like on the left, is more oblong. So instead of being like instead of being like a basketball, it's more like an American football. And what that does is light coming in, depending on which axis it's coming in at, is bent differently. And so things get blurry. We can correct that with glasses. We can correct that with contacts. But when it comes time for cataract surgery, we got to take this into account, especially if you want to be able to see in any particular distance with your glasses off. So we have all sorts of toys. In fact, when you come, you may be a little surprised how long the visit takes. And part of that is because we take so many measurements. You know, if you go to your primary care doctor and you need an MRI or a CT scan or lab work, they're going to send you out to go do all that. But when you come to the ophthalmologist for cataract surgery, we typically get all sorts of tests like those right there in that visit. So it can take a few hours to come in, get all these tests, and then have us check you out and go through this discussion together. So this this picture you're seeing on the right here is a topographical map, and the colors are the warmer colors are the steeper areas. So basically, you're thinking of the cornea, that front surface of the eye, and we can map out where the steep areas are and where the flat areas are, and we can measure the astigmatism, and that is something we take into account as we're talking about your lens options. So we measure that with multiple different measuring devices. We also measure the length of the eye and the other aspects of the eye that help us predict what power lens you're going to need specific for your eyes. So we have just stacks and stacks of lenses, kind of like shoes in a shoe store, right? They come in all different sizes, and we want to find the one that's particular to you. So you probably heard about other eye conditions as well. Macular degeneration, glaucoma, diabetes can all affect the eye. And when we're doing cataract surgery, we need to take all those into account. So we're gonna look at your eye. We're gonna look at the retina. These are pictures of the retina. On the left is the normal retina. On the right, we can see some aging spots from macular degeneration. And if we saw this, we would get another scan like this. This is an optical coherence tomography scan. The name doesn't really matter, but basically it's a scan of the macula. So on the left, we see a normal macula with that nice little divot. The different layers of the retina there are showing up beautifully. And on the right, it looks totally different, right? If there's not that little divot there, there's a mountain. And in that mountain area, we see black areas which represent fluid. So there's a lot of swelling going on here. So this would be a representation of wet macular degeneration. And again, the retina is like wallpaper inside of the room. So if that, or like film inside of a camera, and if that film has a wet spot, then the vision, no matter how clear the light gets to the macula, the vision's not going to be as good as we want it. So this is just one example. Again, glaucoma can affect things, diabetes can affect things. There are a whole host of things that can affect the other parts of the eye that we're not treating. And let's talk about why that matters, right? So when patients come in, I'll sit down and kind of draw the eye out for them. I always joke that I'm a great surgeon, but a terrible artist. So you have to put up with my drawing skills. But in addition to the cataract in blue, we can have dry spots in red, like we talked about. We can have astigmatism in terms of the front shape of the eye, like we talked about. And we can have issues back here in the macula. And notice that all these things are in a row. So light coming in is going to deal with the dry spots, the astigmatism, the lens, and the macula all in a row. And so if you have conditions other than just the cataract, and you're coming in and we fix the cataract, you may still not be happy afterwards if these other conditions aren't treated or aren't addressed, or we don't have a common understanding of what to expect afterwards from those. So I really can't emphasize this picture enough. To me, this speaks volumes. We have these different things that are causing blurred vision. We have to address each one if you want to have the clearest vision possible. Okay. So then we get to the part of the discussion where we say, gosh, we have different lens options, and which one is going to be right for you? And this is something that's really changed over time. When I first started years ago, there weren't that many options. There were just a couple options. People came in, we said, here you go, this is your option, and we just went forward. But now, to me, this is really a key area where people get stressed, and also a key area where we have the chance to relieve a lot of that stress if we spend time talking about the lens options in a way that's coherent and that's simple and that's not overwhelming. And typically I'll just break it down. I don't usually name each lens, but I like to group them into function. What is this lens going to do for you? What is that lens going to do for you? And what are your goals? We'll talk a little bit later about what your goals are and why that matters. But basically, there's like three groups of lenses, right? The standard lens is going to help you see better. We're going to take out that cloudy cataract, but we're not going to correct astigmatism. We're not going to correct presbyopia, which means, the ability to see, or the loss of the ability to see far and near. And so we're going to rely on glasses. The glasses are going to work better. They're going to be a new, updated, different prescription, but they're going to work. They're going to work better than they did before cataract surgery. And so we're going to need them for distance, we're going to need them for intermediate, and we're going to need them for up close. And let's just take just a second to define what I mean by that. So near is kind of right here, right in front of you where you read. Intermediate is the computer screen, it's arm's length, it's the dashboard on your car, it's the menu, it's the, like I said, the computer screen. And then far is really anything past arm's length. So distance is anything past arm's length. Excuse me. So that's the standard lens. The standard lens is going to do a great job, but we're going to really rely on and lean on glasses afterwards. Now, some people may say, well, gosh, That's great, but I was really hoping to have some freedom from glasses. What else you got? Well, we have lenses that can, and excuse my smiley faces here, but we have lenses that can help you see well at distance, but you're going to still need the intermediate or the near in terms of you're going to need to wear glasses for those. And then we have lenses that give you more. Here I've drawn out distance, intermediate, and near being smiley faces. We have ones that do two of the three. We have kind of all sorts of things. But as we get further away from the standard lens, as we wear less and less glasses, we start making some compromises. Maybe that the clarity is just a tiny bit less. Maybe as we get all the way over to the right, we're having some glare or halos around lights at night. And these are all things that really we want to sit down and really want to talk through. We actually, when you come in, we have this sheet that you fill out and it asks you about your goals. And so we'll sit down and we'll look at that sheet together. And then I'll go through these groups of lenses and I'll pick 3 or 4 lenses that would work for you. And we'll talk about why each one may be a good fit. We'll talk about the pros, we'll talk about the cons, we'll talk about the cost. And there is a cost. And that's another thing that can add stress to people's decision-making process. You know, frankly, there's a cost whatever you choose, right? Even if you choose the standard lens, glasses are not cheap, particularly as you get new ones, every year. And so there's a cost there. And then on the other hand, there's a cost to some of these upgraded lenses. So it all kind of comes down to what your values are. And people will say, well, doc, what do I pick? Just tell me what to do. Tell me what to do and I'll do it. And I say, well, gosh, it's not that easy. So I usually bring up this example that I have 4 kids and I would never get them the same present because they're different. So for instance, my daughter, like her idea of a good time is she and I on a daddy-daughter date going to get some Vietnamese food. That's like her favorite thing. That's what she loves. But my next oldest, he wants to make some chocolate on his own. He wants to make some chocolate bars and figure out how to sell them and start a business. So his idea of a good time is completely different than my daughter's. And my next oldest son, this is him, he'd made a goal on a trip to eat X number of ice cream cones throughout the day. And here's him towards the end of the day. He was going to meet that goal, no matter how tired or how stuffed he was. His idea of a good time is different than his other 2 siblings. And this guy, he's just up for anything. So it really is hard to tell you exactly what lens you should pick because you're unique. You're an individual. And so for sure, on something like this, on a recorded thing, I can't know that about you. But as you come in and we get to know each other better, then I can kind of guide you into a few options and we go from there. Okay, so different lens options for different people. And the other thing I want to bring up here too is it's really common for people to come and say, well, my friend had this, right? And they're happy. Or my other friend had this and they're unhappy. Remember, if I got my daughter that ice cream cone and gave the Vietnamese food to my son, they're going to be unhappy, even though they had good options. They just weren't the right fit for them. So please take into account what your friends had, but also please have an open mind that something that they liked or didn't like may or may not translate to what's best for you and your particular situation. Maybe they didn't have macular degeneration, or maybe they did and you don't. And so we may have different kind of options. We may have different strategies in your eyes versus someone else's. Okay, so I think it's also important to understand the journey. One of the things that's stressful is just not knowing what happens next, not knowing how long this process is going to take. So I want to share first some just pictures of people you're going to meet along the journey here. We have all the time patients after surgery come back and say, gosh, I really was impressed by the people that I worked with. And so when you come, you're going to meet with some of my team, Dr. Storch, Dr. Duong, Fagel Goldstein. These are people who are going to help you get your measurements, to help you learn more about the basics and about dry eye. They're going to help see you during your post-op visit and help make sure that you have a glass of water, know where the restroom is. I mean, they're there to really help with everything they can, not just from a technical standpoint, but also from an emotional standpoint as you go through this journey. You're going to meet with Mary in the pre-anesthesia care unit, who's going to start an IV and give you drops and get you ready and check to make sure that everything is set up. You're going to come back to the operating room, and we're going to have Faith and Gabby or my other team members who are going to help hand me instruments during the procedure. And you're going to meet with Melanie and her team afterwards, who are going to make sure that you're feeling good, that your pain is taken care of afterwards, and that you know exactly what you need to do from a drop standpoint, from a caring for your eye standpoint. We just have a great set of teammates here. And so what does that journey look like other than just the people? Well, we typically will you'll come in for a visit. Sometimes you'll come in and see Dr. Duong, Dr. Storch, Dr. Marshall first to get some measurements, and they'll start you on some dry eye drops, and you'll come and see me with the rest of the team. We'll go through this process. It's very common, if there's any kind of uncertainty or you're just not feeling like you're ready yet, or I'm feeling like you're not ready yet, that we'll just say, hey, look, come back in a couple more weeks or a few more months, treat your dry eye, and let's talk some more. Let's talk some more until we feel like we're seeing eye to eye, no pun intended, until we're ready. Till I feel like you're ready and you feel like you're ready. And then we'll go ahead with the surgery, typically one eye at a time. And usually about a week apart. So although in some cases we do both eyes at the same time, if you're wanting to, we can talk more about that. I do the surgery 100% myself. You get a call from my team afterwards, and then you're going to see other team members to make sure the healing is going exactly as planned, and you'll come back and see me, and we'll make any adjustments that we may need to make. So all in all, that process takes a couple months, right? So there is definitely time involved here. And even after that few months, there are still some things down the road that we need to watch. How's the lens setting? Is there any scar tissue that's forming? It's very common for haze or scar tissue to form behind the lens. And so we'll be watching for that. Your other doctors will be watching for that. And there's something we can do for that when that happens. Okay, so we talked a little bit about the journey. What else can we expect? One of the big things that comes up, especially when people are paying extra for lenses, is are we on target? And this is interesting. So almost everything in life falls into kind of a bell curve. And when you bring you in and we get measurements, the measurements tell us, well, maybe this lens is the exact lens that this patient needs, or that lens is the perfect lens for this patient. But when we put that lens in your eye, I like to tell patients what I don't have control over and what you don't have control over is how your body heals that lens into place. So your body may nudge it a little bit this way or a little bit that way until it fully locks into place. And so we have to dance with that. If you're not exactly on target, we have ways of adjusting. Some lenses are actually adjustable when they're in your eye, and other times we'll use lasers or other incisions to kind of make a little correction, a little adjustment to get you as close as we can to being on target as possible. And the goal is, again, I draw those smiley faces and I like that. The goal is to get you as happy as I can. At this stage, none of our eyes are 16 anymore, and so nothing's going to be perfect. But if we can get you happy and as close to the target as possible, then I'm feeling good. But what if something unexpected happens? It's legitimate fear. This is my wife skiing, and before we went skiing, we rented some equipment, and this is one of the things we had to sign, right? This liability, and there's things that can happen when you go skiing, and the same is true with cataracts. Now, thankfully, cataract surgery is really, really safe. The complications which do exist are really rare. The complications that I worry about the most include infection, bleeding, and loss of vision. Thankfully, they're really rare in terms of 1 in thousands and thousands. Occasionally, patients after cataract surgery, our eyelids, they droop with time. And occasionally there'll be a little bit more drooping of the eyelid after time. So that's another thing that we think about. But anything can happen. And one of the exciting things for me working here at the university is that when something does happen to somebody during cataract surgery or after cataract surgery or from a trauma or whatever it is, they often get sent here. And so we get a chance to try to fix that and make it better. So I want to share with you a couple of things that can happen not to scare you, but just to kind of give you a flavor of how we approach things and what I do when I go to conferences throughout the United States and throughout the world in terms of teaching other doctors how to approach that. So this may be way above most of our heads, but again, hopefully it gives you a flavor of what else we do other than just routine cataract surgery. So you can have damage to the iris. That's something that's possible. This was a patient who got hit by a golf ball, and the iris just really, you can see the pupil is not working well here. So what do we do? Well, I teach other surgeons that you can surgically connect areas that are not where they're supposed to be with this technique called the 4-throw single pass. And I go through all the steps with them. We talk about how to tie the knots, what to be aware of, how to pull those knots through, how to trim those, and basically how to fix the pupil. So how to make something that looks like this look like this, which is not perfect, but it's a huge improvement over where we started. And then sometimes the trauma is a lot bigger, right? In this case, we actually have artificial iris implants that are hand painted in Germany, customized to look like the patient's other eye, and then shipped and can be placed. Something we can do to place that inside the eye so that you regain the ability of the iris and the pupil to block excess light. Again, I bring this up just so that you have a taste of the what goes on behind the scenes here at UCI as we try to help people in all sorts of conditions. I'm going to share with you a picture from a recent trip to Africa of, I wish I had a more in-depth picture of her eye, but this is a beautiful woman from Africa where she actually needed one of these artificial iris implants, and we were able to take her one, and it was really, really satisfying. Okay, well, speaking of which, I was asking my mom, I said, Mom, gosh, what do you do to help decrease stress during surgery? And she said, I think about your trips and the people who don't have access to cataract surgery. And maybe that's a way to help decrease stress, is just to think, with some gratitude that at least we have a way to fix this problem. And I like that. Shout out to my mom. Great idea. And the last thing that I want to bring up is involving a friend. I love walking into a room to meet a patient, and I look to the left or the right, and they have a family member there or a friend. It's not necessary, but it is really helpful when they bring somebody with them, or they get on they say, hey, can you call my daughter or my son? Or, gosh, can I bring somebody next time? Or whatever it is, it really helps to have somebody else there. When you come in, I mean, all this is a little bit of a whirlwind. There's so many terms, there's so many things that we talk about. And even when we kind of slow it down and take our time, even when we do this over multiple visits, it's still a lot. And so I really invite you, if you can, to bring somebody you trust, somebody whose opinion you trust. In fact, it's a little funny, part of our questionnaire in terms of the goals also asks a little bit about what your personality type is, because some lenses mesh better with different personality types. And somebody will fill it out, am I type A? Am I not? Where do I fit on this? And I'll look over at the family members and they'll say, no, that's not correct. This is what they really are like. And so we get some information about you, but more importantly, you're going to get, another listening ear, somebody who's on your team and who can take notes or who can just help make sure that the information being communicated is understood. And when you go home, you have somebody to bounce ideas off of. For this reason, I also like my patients to go home with a little drawing of what's going on in their particular eye, what the specific options for them are. And that way, when other family members asks, what did Dr. Wade say? They can pull that out and say, well, this is what he said I have. This is, these are my options. These are what they cost. And this is what he thinks I should do. And what do you think? And they can talk it through with family. So involve a friend. Hey, so there you go. I hope that after going through this, you'll take a breath, realize you can take your time, that you know a few more of the basic terms about what's important during cataract surgery, that you understand a little bit more about what the journey looks like, and that you'll bring a friend when you come in. And this is my 4-year-old, soon to be 4-year-old this month. And I asked him last night, I said, Dad's talking about this. What should I tell people? And he thought for a minute, he said, tell them you're a ninja. I have no idea what that means or, how that really relates, but I just thought it was super funny. And he was so serious about it that I told him that I would tell you that. So hopefully, maybe we can make up that we're cutting through some of the stress like a ninja would. One last story with the same little guy. So this last year, I took my family sledding, and this a particular sledding area, you actually take a little bit of a lift. It's actually a moving walkway, and you get your tubes, and you go up the slope there. And this was the little guy's first time or anything like that. So my wife was stressed. The other members of the family weren't sure how he was going to do. In fact, he was kind of stressed up there at the top. And we had him sitting in a tube by himself, and my wife was going to go right next to him and kind of hold on. No, sorry. There was two seats in the tube. So we put him in there, and before she could sit down, the tube started going, and he just went by himself. And here we're thinking, oh my gosh, this is what's going to happen. But he just screamed in joy and just loved it and wanted to go again and again and again. And probably that's not going to happen for you in cataract surgery. You're not going to be so happy you want to do this again. It's not Disneyland. But my hope is that it's a little less stressful after knowing some of these things.